Hi, I'm Jasmine Chris. I'm a clinical research coordinator 2 here, and we're going to be going over what it looks like to do a proper blood collection. We're going to be going over sample processing and packaging and shipping. Some of the first things that we really want to highlight are going to be, of course, hygiene, sanitation, safety, and then subject verification. So before you perform any study procedures for a subject, you want to make sure that you have a signed and dated consent. And then after that, you're going to gather all of your materials. This is going to be for the blood draw. So you want to make sure you have your gloves, that you have your biohazard bag, and then you have a tourniquet, your needle, your tubes, and then your alcohol prep pad. And then last but not least, you're going to make sure that you have the right subject number before you do anything, and you're going to verify that subject to the patient either by date of birth, first and last name. So here we go. Thank you. Okay, so right now we're in a patient exam room. Whenever you have a patient appointment, you can book them here, or you just want to make sure that you are doing anything for the patient where they have their own privacy. So we're going to get ready for our blood collection. I already put my gloves on. I have my mask on. My patient is not. Okay, so first we're going to tie the tourniquet like so. And this technique allows for an easy release. You just pop it right there. Then we're going to find the vein. We're going to palpate. We're going to go along the direction of the vein, and you never want to palpate with your thumb. Once we find it, we're going to use alcohol to go from in to out to sanitize the area, and we're going to let that dry. And you never want to leave the tourniquet on for more than 2 minutes. And then once it's dry, we're going to go in with our needle, and you want to be sure to never touch the area that you just wiped with alcohol. And you're going to insert. And then you only need to insert the needle just the bevel. And then you're going to invert the tube 5 to 10 times. And then we're going to pop the tourniquet, put on the gauze, and pull the needle straight out. And then you always want to cap your needle for safety. And then wrap with the Co-band, and then you're done. So now that we have our tubes, we made sure to invert. We want to make sure that they're full. So here's the fill line right here. Sometimes it won't fill all the way up because of the vacuum on the tubes. So now that we've got those, we can prepare for transport. You need a biohazard bag. If you don't have a biohazard bag, you could use a cooler, or what else? I think that's normally everything that we use. So we're going to put them in here, and we're going to go to the lab. For the next step for sample processing, you want to make sure that you're following your manual. So these are our sample processing instructions. We already collected the blood. We inverted 5 to 10 times, and now we need to let the serum sit upright for a minimum of 30 minutes to ensure the formation of a solid clot. Now, the serum has to sit for 30 minutes, but the other 2 tubes do not. So we're going to wait for the serum to be done so that we can spin all 3 of them together.
Our blood sample has sit for the appropriate 30 minutes. We're not going to go ahead and start putting our samples in the centrifuge to process. But to do that, we have to make sure the centrifuge is correctly balanced, otherwise results can go bad. So in order to correctly balance a centrifuge, you have to balance each specimen within the centrifuge. So this is our original sample. As you can see, the meniscus is pretty high up on there, so we want to find a counterbalance for it. This one is the appropriate counterbalance. The heights are about similar, so this would be okay to put into the centrifuge. On the other side, we have something that is improperly balanced. This would throw the centrifuge off and again results in bad results. So we're going to go ahead and place these in the centrifuge. I'm going to make sure I place them directly across from each other. So if this sample goes here, I'm going to go straight across, and it's in the bottom one, so I'm also going to put it in the bottom one. And then my other samples can also be processed at this RPM. again, balanced correctly. And then we're gonna go straight across. One's here, one is going directly across. And then my EDTA, my purple, again balanced. And for these small tubes, we do have to insert little sleeves into the centrifuge so they don't get stuck. And when you insert the sleeves, you also have to make sure these are balanced as well. So here are my sleeves. I go one here, directly across, directly across. I close my centrifuge and then I spin according to protocol. So this protocol calls to be spun at 3,000 RPM for 15 minutes. In order to change the RPM and the time, you just press the up and down buttons. So we need 15 minutes, so we're gonna press up. And then we need 3,000 RPM, so we're gonna press down. After that, we just press start and let it go. Wait a couple of seconds. We're gonna wait a couple seconds so it's all started up, and when it's hit this RPM, and then these are safe to be processed for the next 15 minutes. We're gonna go ahead and take our samples out. So this is what it should look like. We have our red blood cells, and then this layer is what we call a buffy coat. This is basically the additive that was in the tube, and then we have our plasma or serum. So you can definitely see the red and the yellow difference. We're going to set that aside and take the rest of them out. Our counterbalances can go back into our little area, our rack. Again, this is what we want to look for. Last one. We can go ahead and put this proper way. This is what it's supposed to look like. In the event that something happened wrong in their collection or didn't clot right, we could have what we call the hemolyzed sample, which means some of the red blood cells got into the plasma and this will look all red and yucky. You can try to send it off to the lab, but you might not get accurate results, so we really want our samples to look as clean as possible. And when we're working with our specimens, we have to work behind this plexiglass case to protect ourselves from blood spatters, biohazard things of that nature. So now we have the materials we need. We do need our pipettes. So these are sterile pipettes. We also have our transport tubes, and we have our protective layer. So we're gonna go ahead and start aliquoting the first sample, which will be my gold top. We just pop it off as gently as possible because we don't want to mix up the plasma and the red blood cells. I take my sterile pipette. And when I'm inserting the pipette, I want to make sure I do not touch that buffy layer or the red blood cells because we don't want to contaminate the plasma. So I'm going to try to get as much plasma as I possibly can. I'm gonna set that back down, out of the way, and then this is my transport tube. If you can go back and get more plasma, go ahead and do that, but if you don't feel comfortable, just get as much as you can. I think I can go back, so I'm gonna get some more. Okay, that's all I feel comfortable doing. So now, the pipette goes in biohazard. Red bag. I'm gonna cap this off and appropriately label with the labels provided by the sponsor. And when I put the label on there, this should have a barcode on it, but we did not include one. Make sure the barcode label is vertical and can be easily readable. And then we put it in our absorbent packing and we are done. We keep processing the next ones.
So right here we have Ananda continuing to sample process the rest of the tubes. She's first going in with the heparin and then going in with the EDTA next.
now that I'm finished aliquoting off the plasma, I'm going to recap the blood specimens, and then I'm going to throw them in a biohazard, biospecimen bag, seal it up, and then place the whole entire bag into biohazard. Now we're done processing, so we can go ahead and pack this up. So I have my absorbent material. I'm going to fold that up and put this in our self-seal bag. And then I also have our lab requisition, which contains what all is in this bag, so the lab knows to go ahead and process accordingly. Without a requisition, you will not get lab results back. Please make sure to include this. And in the back of this bag, there's just a little slot for that. And then you just seal, you pull off this and seal according to the bag. So this one says fold at the slits. That's what I'll do. And we are good to go. So now I can go ahead and put my dry ice in my shipping container. Please note that the shipping container box does contain the biosubstance category B warning. And the flip side of this box has the dry ice warning.
Just a basic overview of what it could look like if you have to do a blood draw for a study, and just remember that everything will always be study specific. One thing that we do want to highlight and emphasize is to always wash your hands between study procedures, between blood draws, between sample processing, and make sure you're changing your gloves also.
If you have questions, you can always reference your lab manual and always ask your coordinators. They are always there to help.
Just want to reassure you that you will have time to train and become familiar with these materials, and you definitely will have somebody that is a good mentor to go over everything with you and help you throughout. So thank you for watching our video, and I hope that you learned a lot from it.